Thank you for joining us today, Dr. Kiaii. It's such a pleasure to have you on the show.
Thank you for having me. It's a pleasure to be here.
So can we talk a little bit about the correlation between diabetes and kidney disease?
So as many people know, diabetes unfortunately can have a lot of different complications. So we always refer to it as you can have small vessel involvement because of the blood sugars being elevated. It can damage the little blood vessels, and you can also have big blood vessels affected. So when people have big blood vessels affected, they're at risk for getting heart disease, which we know people with diabetes are at way higher risk of having heart disease than someone who doesn't have diabetes. Similarly, the small blood vessels can get affected. So the eyes can get affected, where people will have problems with their eyes and they can require laser treatment of their eyes. The same small little blood vessels are in the kidney, and so therefore the same little blood vessels get affected with the diabetes. And so the better your diabetes is controlled, the less the high blood sugars are occurring, the less damage those little blood vessels will affect. So there's an absolute correlation with having diabetes and how well it's controlled, and how these organs that I mentioned and the kidney getting involved. So people with diabetes, if the kidneys start to get involved, usually the first signs is they start to leak protein in their urine. And that's why all diabetics should have routine screening of the urine for protein leakage, because that's the first sign that the kidneys are getting, that little blood vessels are starting to get damaged. And there's lots we can do to reduce that damage with good blood pressure control, making sure the sugars are well controlled, and implementing medications. So blood pressure medications like ACE inhibitors or angiotensin II receptor blockers specifically work in that area and reduce that pressure, reduce the protein leakage. The SGLT2 inhibitors, they reduce it. And now we know that medications such as Ozempic, which is used for diabetes, can also help with reducing that pressure as well, and hopefully reduce the protein leakage. So there's lots you can do. So that absolutely there's a correlation. It's important to screen early and start to do something about it early to prevent that damage from occurring.
Are there any specific symptoms of kidney damage that are linked to diabetes, or is it the same no matter which disease causes kidney disease?
They're usually the same, but people with diabetes usually develop symptoms earlier. So often we have to implement the interventions that we do a little bit earlier in their percentage kidney function. And often people with diabetes will require to start dialysis a little bit earlier. They just get their symptoms develop a little bit earlier and then tend to be a little bit more pronounced. So that's the one thing, but it's usually the same symptoms: water retention, not able to get rid of that, ankles starting to swell, feeling short of breath, and then feeling tired and not having the same energy. So those are the things that we still see with diabetes. And the other thing that I think gets a little bit more complicated with diabetics is that as part of kidney disease, you can get some nerve damage and get what we call peripheral neuropathy, but obviously diabetes as well, because of the small blood vessels affecting the nerves, can get peripheral neuropathy. So then their peripheral neuropathy can be a little bit worse than the person who doesn't have diabetes. I do want to stress again that I'm not sure if people fully understand the importance of checking that urine protein, because I will have patients who will say, but my GFR is 70%. I'm okay. I'm not at a high risk for getting worsening progression. But then we tried to tell them, but you're leaking a lot of protein. And that tells me that you are going to progress. We recently have a new way of calculating the risk of progression over the next 2 to 5 years. It's called the kidney failure risk equation. So we put in parameters into this equation, into this formula, and it tells us what's your risk of requiring dialysis in the next 2 years or in the next 5 years. And when you plug into this formula a small amount of protein, your percentage risk is very low. If you keep everything else the same, including your GFR, but put in that your protein leakage is higher, your risk doubles, triples. So the protein leakage is very important, and often people focus on what's my GFR, but they should also focus how much is my protein, what can I do to help to reduce the pressure inside the kidney artery so that can reduce the protein leakage. And that's especially important in diabetics.
And is that true for other people as well?
Absolutely.
If they're having large protein leakage?
Absolutely,
So
yes.
definitely
yes.
something you should be paying attention to seriously then.